Today I'm going to talk about the cortisol DHEA ratio. Now that's going to involve the adrenal glands. So I'm going to actually go by this chart. I'm going to do 5 different sessions because it would be too long to do in one session. So I'm going to try to do 5 short sessions on this chart and how the cortisol DHEA ratio can affect the body. Now this chart's not mine. This chart is from my good friend, Dr. Todd Frisch. It's in his book, if you want to see it and read about it. His book's on Amazon. It's called Why the Face. Dr. Todd Frisch, very good book just to read. It's on face diagnosis of things we see in the face as far as health and all kinds of cool stuff like that. But I called him up. I said, can I use your chart? He said, okay. I said, good, because I can't beat this chart. This chart's great. So you can have normal DHEA and high cortisol. You can have low DHEA and normal, high, or low cortisol. Now, if it's low DHEA and low cortisol, that's the end stage of adrenal exhaustion. And a person's going to feel awful if they have that. But they'll feel poorly in a lot of things. This can affect a lot of things. So when we look at this, we do things to support all these things. Patients feel better, but sometimes we got to look at this ratio and see if it's involved. So here's a little graph I made. This is the ASI test is what we use, adrenal stress index, for this. This is just the graph. There's a lot more information we get besides just the graph. But I drew the graph, and it's called a diurnal curve. It goes like this. This is 8 a.m. This is midnight. We should be highest at 8 a.m., lowest at midnight. Now, when we're high at midnight, that can correlate to depression. So that can be just a bad outcome, and we have to look at that and treat accordingly. So we're never giving things. We're not taking like, okay, this is this. We're giving a pill to do this, to fix this. Okay, it's not like medication. We're giving nutritional support so the body corrects itself. We're never treating anything. We're just giving the nutritional support so the body does its thing, and so the patient can feel better. So we're always looking for the root cause. We never want to treat just a symptom. We always want to find the root cause. So a single sample for these tests is not adequate. This is taken over 4 tests, and then we do a 5th vial now also, so we can see the curve. And I have patients coming in, they say, well, I got a single test, cortisol test. I said, is it just one? Yes, just one. It's pretty much worthless because you can have, let's say you took the 12 a.m. dose, it might be up here, but you didn't take the 12 a.m. dose. You only took the 8 a.m. dose. So you have to do it through the day for one day to get the accurate results. We do this test all the time because it's so helpful. So when we talk about the brain, though, the brain, if we have a cortisol DHE ratio that's off, the brain can decrease serotonin levels. So when we look at the neurotransmitters, serotonin, dopa, GABA, and acetylcholine, serotonin is the one. Women are governed by serotonin. So serotonin is increased by things like caring, serving. That's why women are better at those things, because the body's created, if they care and they serve, it increases serotonin. Now, the serotonin is synthesized by the enterochromaffin cells, hard to pronounce, that are in the gut. 5 to 10% of the serotonin is in the brain. The rest is in the gut. And that's why we talk about the brain-gut ratio, brain-gut axis, the communication between the brain and the gut, whenever we talk about digestion, whenever we talk about depression, anxiety, ADD, ADHD, whatever we're talking about. So serotonin is also governed by relationships. So I'm going to talk about that in a second, I think. So when serotonin is down, that can set off the other neurotransmitters. Dopamine, which men are governed by dopamine. And so that's why men are motivated by what? You got it, sex. So men are motivated by sex because of this dopamine. So serotonin levels can change dopamine too. Men have serotonin, but they're not governed by serotonin. So GABA, if it's off, can have anxiousness, overwhelming feelings, things just overwhelm you, depression, and acetylcholine, the 4th of the neurotransmitters, can have to do with mental disorders and stuff. So we take patients and we change this thing going on and all of a sudden they're on medications for depression or anxiety, and they say, you know what, I don't feel like I need a medication anymore. So I say, look, go back to your medical provider and see if you can start, or she can start titrating you down on some. So usually that they do that, it goes good, they get off the medication. So one thing, you know, with men, I'm going to talk to men for a second. So men, like I said, dopamine, they're motivated by sex. So when you sit there, guys, and you speak rudely to your wife all day, you don't give her the love she deserves, you say things that aren't appropriate, and you just don't act cool, serotonin governs relationships, and so that affects them. So then at night, you get already, your dopamine levels up, and you're like, you know, come on, baby, light my fire. Ain't going to happen. Ain't usually going to happen. Because if you're not treating them correctly, it messes with their serotonin levels. So start treating them correctly. I mean, that's what the Bible says, Ephesians 5. It says, husbands, love your wife as Christ loved the church and give your life for her. That's how you're supposed to treat your wife. Okay, so if you treat her right, it will fix that little thing you're supposed to have going on. So there's no way to measure specific neurotransmitters. So we use the cortisol DHEA ratio to find out what's going on. That helps us with the brain. So if you have any questions, you can always call office 314-843-9355. Until next time, reclaim your health, reclaim your life.